Okay, perfect. Good morning, everyone. I'd like to call this Board of Supervisor meeting to order. The date is May 11th. The time is 9:01. I would ask everyone to please stand. I'm going to ask our Treasurer Tax Collector, Donna Riley, to lead us in the pledge and then remain standing. And Mike Gunderson from the City Ministry Network will lead us in a prayer.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Let's pray. Heavenly Father, thank you for this day. Thank you for our community. Thank you for the beauty around us and the resources you've given us as a community. We thank you for the freedoms we have as a country in which we are free to have a voice in our governing process like today. I pray for our community, Stanislaus County. There are many blessings, but there are also many needs and challenges. I pray that those who live here who are broken, addicted, and living without hope, those who have lost jobs and are struggling to get by, those who are struggling in business and maybe personally struggling with their own health, would find joy and hope, health, provision, and a deep sense of community in their lives. I pray that businesses would prosper, our schools would flourish, and neighborhoods would experience peace and healthy relationships. May this truly be a great city to grow up in and grow old in for every citizen. I ask that you would bless our leaders here today who have been elected into these positions of authority. I pray that you would bless their families, their friendships, their health, and their businesses. May each of them come to know the depth of your love for each one of them. And I pray that you would give them the wisdom and insight and integrity as they lead. Give them unity and humility. Guide their discussion and their decisions on every item this morning. I ask this in Jesus' name. Amen.
Thank you, Mr. Gunderson. And thank you, Treasurer Tax Collector Riley. Appreciate you doing that. Okay, we'll move on to 3, but we do have a change in the agenda.
Yes, good morning, Chairman Chiesa and members of the board and everyone who's here this morning. Welcome. I did want to make the announcement that we are going to postpone item number 3, which is a presentation from the Stanislaus County Employees Retirement Association. We did have a change in availability and schedule, so we're going to go ahead and re-agendize that for a couple of weeks out. And in tandem with that, I would ask that the board remove from consideration item B11 from the consent calendar, which also addressed retirement rates. You won't see there are no substantive issues with the agenda item. However, we would like to take up that agenda item on the same date that we do that presentation with the retirement director here. So if that's okay with you, then we'll go ahead and move on to item 4 for presentation.
I just want to read really quick. I have an announcement. This meeting is open to the public to provide for social distancing. The chamber audience seating capacity is limited to approximately 30 persons. We have overflow space and staff available to help you find a seat. Consistent with guidance issued by the California Department of Public Health, face coverings are available to all members of the audience and participants in the meeting. Under the guidance, there are exemptions for their use, and therefore the public may see some individuals during the meeting not using them. Public comments will be limited to 5 minutes at the discretion of the chair, depending on the number of speakers. Public comments submitted by email before the start of the meeting will be made a part of the public record and distributed to the board members for their consideration. Please email your comments to the clerk of the board at cobsupport@stancounty.com, cobsupport, SUPPORT, at stancounty.com, and list public comment period or the agenda item number in the subject line of the email. You can watch this meeting, so it can be observed at www.stancounty.com/sclive/ these backslashes are killing me. We are on YouTube now, also at stancounty.com/BOS/YouTube. We haven't got 100 subscribers to get a direct link yet, but we're close. So please go ahead and hit the like button, or the subscribe button, I'm sorry. In addition, board meetings are broadcast live on local cable television on Channel 7 in Modesto, Channel 96 in Oakdale, and Channel 19 in the rest of the county. So with that, we're going to go to item number 4. It's our standard update on the novel coronavirus. Dr. V and Marianne, thank you for coming in.
All right, thank you very much. Good morning, Chair, Supervisors, Mr. Hayes and Mr. Bowes. It's wonderful to be here again this morning. I'm going to start with our usual update in cases and hospitalizations. Here's our EpiCurve that we show each time we're here, the blue being the confirmed PCR, the green being the probables, which can be antigen tests. And you can see we've been holding pretty steady, just somewhere around, between, I would say, 50 and 70 cases per day, which is still pretty high, but we are holding steady. If we look at our hospitalizations in the orange and ICU pulled out of that in the red, you can see we've been just kind of jumping around a little bit on our hospitalizations, but over this past week we've seen a nice decrease down into the 60s, so that makes us happy from just being over 100 a week or two ago. So it's a nice decrease. We hope that that stays down because that's really good. We want to see a lower hospitalization in our community. As we look at the tier update, as you recall, this is unofficial, just what we see before it comes out at noon today. Our unadjusted case rate is 10.7, it's about the same as last week. Our percent positive at 4.1 overall. What did increase was our percent positive in the lowest quartile of our Healthy Places Index. It went up to 5.5. I believe it was 3.7 2 weeks ago. So that now lands us in the red tier, which is fine, but it's a little bit high compared to those around us. Our test volume, 351.2 as of yesterday that I could see. The state median was 325.37. They are adjusting it each week, and then they calculate your adjusted case rate for posting. So this all seems very stable, and our testing volume is staying just a bit above state median so far. So we usually get adjusted down maybe 0.1. So we'll see how it comes out today. But this keeps us pretty firmly in red. Just looking at the trends here, in our case rate, you can see just hanging right around that purple line. As you recall, 10 is the line for purple, so we're just hanging, dip below just 1 week. I think we had a 9.7, but other than that, just staying really right around 10. And then the percent positive, as you can see, we were pretty low. We came back up. Maybe we're dropping again. It could have been a spring break / Easter, a little bit of a bump. We're not sure, but we definitely did see an increase in our percent positives. I just wanted to talk about the variants a little bit. I talked about them last time and showed what there was in California, and we've gone up to 17 B117s, which is the one first identified in the United Kingdom, the B1351, which is the first identified in South Africa, 3. We don't have any of the P1s, which was first identified in Brazil, and then the B1427 and 429 are the California or West Coast variants. They were the predominant strain, and we have had 4 so far. So we were talking last time about how the B117 is certainly what we see most in our genotyping here. The state website now shows the proportion of each variant over time, and you can see in April it flipped from being the B1427 and 429 predominant to being a B117 predominant with almost 50% of all the genotyped cases. And they're genotyping a pretty good number now. I think it's above 10%. So that's there's a lot of samples in California. So that's a goodly number being genotyped. And so we have a pretty good handle on what's circulating. So it has gone into a B117 predominant in the state of California. It has always been that way as far as we can tell in Stanislaus County. Okay, and finally a bit about vaccines. I have quite a few slides here, not having been here for a few weeks. We right now have given about 358,000 doses to our residents. We see 52% have at least reached 1 dose of all those eligible, so 16 and older. And I'll talk a little bit more about that age group. 31% fully and 21% partially were the numbers as of yesterday. Here's the graph by age, what we can see. So I have those totals on the end that I just talked about. The 65 plus is doing great at 80%. And then we see it decreasing as we get younger in age group. So The 16 and 17-year-olds are moving, 18 to 49-year-olds. Still quite a bit of work to do. 50 to 64, we have 62% with at least one dose. So not too bad, but still some more vaccines to be giving. I want to say just a little bit, because yesterday afternoon we got stuck in denominator discussions. So I just want you to know these are probably the most conservative estimates you're going to see. We try to use Department of Finance denominator numbers, but the problem is you can't break those out by zip code and get HPI quartile. So they were using American Community Survey, just so you know, which has a lower denominator. So these numbers are going to be about as conservative as you get, which is great. If you look at it the other way, we're at 88% of the 65 plus. So, finding truth is very difficult. Picking the correct denominator is very difficult, but we're trying to show as accurate as we think we can get it. And so here it is, but you'll see state numbers that might be a little bit higher than what we're showing you here today. But I did want to address that because our denominators are a problem, and they're going to be different depending on what variable we're looking at, just because the American Community Surveys only breaks up by 5-year age groups, so as we go to 12 to 15, we can't continue to use that to get accurate denominators. So we spent a long time yesterday afternoon trying to pick the correct denominator to really show you the best data we possibly can. So it was probably too much information, but I want you to understand why you're going to see some different information when you look in different places. So here is our vaccine coverage by race and ethnicity. So what we see, we know our American Indian, Alaska Native, our Native Hawaiian, Pacific Islander are small age groups. So, and our Black is also a small age group, but not showing a lot of movement. Really, as we know, our Hispanic and white non-Hispanic here, and we can see Hispanic is lagging a little behind white non-Hispanic, but not too much. We still have some work to do in that community, but really trying to look at our data here in many different ways to try to target our vaccine efforts. I put in this vaccine coverage by city, so you can see our cities are really pretty good. Waterford is the lowest, but also quite small. Just you could increase that quite a bit with just 100 or 200 extra vaccines. But otherwise, you can see not a lot of city variation, but putting this up there so you can see basically some of the ways we're looking at the data and trying to target our vaccine efforts. And then our HPI quartiles, you can see here, HPI quartile 2 is higher with 56% total with at least one dose, and then you can see the 1 and 3 lagging a little bit behind that, but still, again, things we're looking at to target our vaccine efforts. These are our doses per day. You've heard about this nationally in the state and everywhere that vaccine demand has been going down a bit. We're still doing about 3,000 per day, which is great on average. Obviously, not all our clinics. Many of these are being given by our partners, but still, the demand has definitely peaked. It seems to be coming down. We will see, hopefully, an increase in demand later this week as we move into younger age group. I want to talk a little bit about our vaccine hesitancy because, the demand's lowering when we still only have like 50% of our population with at least one dose. So what does it look like? So you can see here on this graph, there's a couple different sources of data here, so please don't try to compare the numbers. This is a state survey, and you can see total in 18 plus. The group we really look at is that light orange one, the undecided, somewhat likely. It's very difficult to move the rejectors. And then the gray at the bottom is, the supporters. They're going to get vaccinated, already have been vaccinated, that group. So it's really looking at that orange of who we can really get. As you can see, Black African American has a lot of undecideds to work at. And this one is broken out, the Latina is broken out by bilingual or predominantly Spanish speaking, and there are some differences in those groups. As we look at, this is another one from CDPH, looking at age groups and essential workers. I think essential workers are a place where we probably need to do more outreach and work because there's a lot of undecided, somewhat hesitant. Those are the ones that are open to hearing some more information. So you can review that, some of the data we're looking at to inform our vaccine efforts. And then I pulled this out. Looking at what you hear, it's the same in California as nationally. This is California data again. You can see the lower the income, the less likely they are to be vaccinated in general, and the more rural, the less likely they are to be vaccinated. So, but we have some good group in there in orange that we need to work with to promote vaccine and really have people understand the value of the vaccine and what it is they really should be getting. Then the children 12 to 15, I think everybody heard that the FDA approved the Pfizer for children 12 to 15. The Advisory Committee for Immunization Practices that advises the CDC is meeting Wednesday morning and will vote. The Western Scientific Review Work Group will meet sometime on Wednesday afternoon, so we are hoping to move forward with opening vaccine up to 12 to 15-year-olds Thursday morning. So we can't do it before Thursday morning. My turn is supposed to be in place to be able to register Thursday morning. So hopefully Thursday morning we'll be able to start vaccinating younger age groups. And thank you. I'll turn it over to Mary Ann Lilly.
Thank you.
Sorry, that's okay.
Okay, so this slide is kind of goes along with what Dr. V said about the declining demand. I think probably the most important row on there is to look at the first doses. And you can see how the demand is dropping in our pods, in our vaccine clinics. And I think that our timing of trying to wind down the large mass vaccine clinics is right on, because there's a lot of resources that go into that and not enough individuals coming in. So our transition work to go to more mobile is I think on the right timing. Okay, next slide. This just gives you a look at what we're doing this week. These are the 4 regional vaccine sites. This Friday will be the last second dose clinic in Oakdale, so we won't be in Oakdale with that standing location any longer. Okay, let's go to the next one. And then this shows you where we are on the mobile clinics, where we're really trying to ramp up more. I can tell you that we've already confirmed one more since this was put together on Wednesday from 3 to 7. We'll be at Riverbank High School, and it is available in my turn now. We are also on Saturday, we're just sort of holding, provided that 12 to 15-year-old approval goes forward, we're going to plan to have a Modesto base location on Saturday to try to serve that new demand. Then the other thing I want to mention is that we're doing an awful lot with schools. So I mentioned Riverbank High tomorrow. We already have other schools scheduled out over the course of the next couple of weeks, and we're doing it by prioritizing based on the HPI-1, where Dr. V showed you we're a little bit behind there. So that's where we want to go first. Okay, this is a slide about that's from CDPH. I wanted to talk a little bit about homebound. Those that really have difficulty getting out to, whether it's to a public health vaccine clinic or pharmacy, the doctors, due to transportation issues or fragile due to health concerns. So there are really 2 different avenues right now. When we learn of a referral, we're working with Sutter. Sutter is doing a homebound program. We have referred a little under 40 individuals so far for the Sutter homebound vaccine program. They're using the single dose, which I think is what you're going to find with the homebound. And then this program is through the state, and through the My Turn app now, if you go on, there's additional questions that begin that screening process as to whether you have a transportation barrier or a fragile health condition to where you have difficulty leaving the home. And you can begin that process to make arrangements to get an appointment scheduled. The state then, and I want to tell you, this is a state graphic that you're looking at, and when you see LHJ, it refers to local health jurisdiction, and that really means county public health. So we would then get a referral from the state. We've had one so far, so this is actually up and running. And if the Sutter Health option if they've reached capacity, if we get to that point, the state has arranged for, through the Emergency Medical Services Authority, has arranged ambulance-based strike teams that we will work to help schedule, and they'll go out and do the homebound vaccinating. So, there is a screening process to ensure that the service is for those who really need this homebound service. But I wanted to make sure that the public is aware that is available. Okay, so this is the My Turn app, and I've put this up with the email address and the phone number. But I've also added our call center line. If anyone needs assistance in trying to get an appointment scheduled or transportation, they can call our call center line, and we'll help them. We can help them get an appointment through My Turn too, if that's the kind of assistance that they need. Okay, and this, again, we want to encourage the public to get vaccinated if you haven't done so yet, and continue to take precautions so that we can drive our case rate down. And I've listed there the testing locations that are available. Easiest way is to go onto our website and find the testing sites and make an appointment. Okay, and I'm going to turn it back to Dr. V.
Yeah, so I was going to close just with this slide, talking a little bit about why it's important to get vaccinated. I hear some people say, well, I just want to get the infection. I don't want to chance the vaccine. You hear all sorts of, just get infected and get it over with type attitudes. So I thought I'd bring forward why vaccination is so important. With a natural infection, you're more likely to be reinfected. These vaccines, they actually titer how much dose you get to get you the right amount of immunity that it should last quite some time, as long as the viruses don't change. We know with natural infection, especially if you have a very mild case, you don't develop a very strong immune response, and there is more likely to be reinfected sometime down the road because you haven't developed that strong immune response. You're more likely to be hospitalized or die. In this county alone, we've had 55,000 cases, we've had 27 hospitalizations, we've had over 1,000 deaths. And with vaccine, we've given over 358,000 doses, and I'm unaware of a single hospitalization and death from the vaccine. It is so much safer to get the vaccine than to take your chance with the disease. It's magnitudes of order safer. So getting the vaccine is incredibly important from that standpoint. As many as 30% of people who get infected have chronic complaints for months afterwards. That's what you hear about the long COVID, the long haul syndrome, what they're trying to name PASC. There's a lot of chronic fatigue that comes afterwards for months and months for many, many people, even young, healthy people with no underlying diseases. So shortness of breath, difficulty climbing the stairs, hard to get out of bed in the morning, just fatigue, exhaustion, pounding heart. It's not a good thing to have, and you do not get that with the vaccine. And then, of course, finally, it really, as a population level, it contributes to variant development. Variants develop and are made when the virus is replicating, when it's reproducing itself, when it's spreading. And so every time someone gets infected, there's more likely another variant that would put everyone at risk because the vaccine may or may not be able to protect you from it and might have to get another dose. So really, from every level, from an individual to a population level, it's really much, much better to get vaccinated than to get the infection. So thank you. That's all we have today.
That's a bunch. We missed you guys. So a couple of thoughts right off the top. The local health jurisdiction through the My Turn, if you're homebound, I had heard that we've gotten one referral, but did we turn that over to Sutter? Does Sutter only do within their own organization? You have to be a Sutter, or they'll vaccinate anyone? And same with the ambulance.
Right.
And so we're not physically, the public health department's not going to go out and administer.
If we find that we need, if that is a
If the need
community
is there.
need, then we'll develop that. But at this point, there are other services available.
Okay. I think that was it. Other questions?
Just real quick, thank you guys, Julie and Marianne, for doing this again. We appreciate all your hard work. So as we phase out of the pods and into the mobile vaccines, so looking at all the mobile units that we have out there, those are all county-run, county units that are out there right now?
Yes.
Okay. Is there, I know there's other, I know Store Transportation at one point was doing vaccines in other counties, or they were doing testing, I think, in one county, and I think they've transitioned into vaccines. Or is there any way, do we need more help? Do we need other units out there that could do more?
Well, we actually have two other vendors that we worked with on testing that I think next week will start doing mobile with us.
Okay.
So it will expand our capacity to get to more places.
Okay. So that's the question. Do we need more? Would it be great to have a bunch of them out there, or what do you guys think?
Well, the state is also taking a look at data like we shared and looking at certain areas that need more assistance. We may have some more state staffing coming in to help with mobile pods as well. So I'm not sure if I can fully answer your question, because right now it's not as though we can just work with any vendor because of the requirements, what you have to do with the state process, right, to be able to vaccinate. So we are hopeful that between our staffing, the two vendors, and the possibility of some state strike teams that can come, that we're probably going to be able to. There's kind of a point at which how many arrangements can we make in 1 week?
Yeah.
The warehouse has to get vaccine out. So right now I think we'll just have to keep judging and watching, monitoring what the uptake is and how much we can do each week.
Okay, yeah, I'm sure there's a lot of variables involved to make it all come together. It just seems like as we close down these stationary pods and get to the mobile, we really want to, if we're really going to try to increase the number of vaccines out there, we need to get out into these neighborhoods. And just seeing 4 units here probably is probably not going to get it, but if we can, it sounds like you're working on it, though.
Yeah, and we're working on a lot of strategy, talking about the vaccine hesitancy and listening to what other areas are doing. The schools, we're hoping it's going to be a good strategy, that there's a relationship, there's a trusted connection between families, and so we're hopeful this 12 to 15, hopefully by Thursday we'll be able to start vaccinating. We're hoping that we're not just going to be vaccinating the 12 to 15-year-olds, but their families' arms as well.
Sure.
So we're hoping that that's going to be an avenue. We're also looking at some various incentive ideas to help bring people in.
So we have the schools involved with this at this point, and they're promoting this and then promoting for the parents also, not just the kids. Yeah. Okay. Good. All right. Thank you, guys.
Thank you. Any other questions? So I'm going to leave it with the last thought. The hospitalizations are down, and I think it's directly attributed to having 80 to 88% of the 65 and over crowd vaccinated. So I think it's a true statement. Even though our transmission rates still seem to be unusually high, we see some really positive news going because of the vaccination, especially on those who are most vulnerable. So thank you very much for coming in. Okay, now we're going to move on to item 5, which is the public comment period. It's an opportunity to speak on any item that is not on today's posted agenda. Please keep your comments to 5 minutes. And I do have some speaker cards. The first one is Brian Evett.
Morning, you guys.
Good morning.
How you doing? I want you to think about this. Cultivate kindness. Okay? Well, anyway, I'm a victim of the Sheriff's Department, all right? And we have an oversight committee that we're wanting to put together for citizens. And I just wanted to turn around and say that it seems like it'd be pretty simple to stop that expense that we have to spend for these oversights by having people do it, when we can actually have the computers do simple surveys. And these simple surveys can be sent out as soon as somebody calls and they've made an appointment. If they've had a problem with an officer or anything, it would be in the survey. And then we can turn around and distinguish exactly which one of our officers are doing well and which one of them are doing bad. And then maybe we can turn around and regulate this by turning around and getting rid of these bad officers that are coming up on our surveys. And we don't need the citizens out there pounding reports. We need a simple survey that is going out to the people that are involved. How was our service? I mean, every store is doing it. You can go to Denny's, eat turn around, drive away, and your survey's popped up. See, you were at Denny's. You know, the pizza places are doing it. I can't see how we would spend this extra money to have citizens going through the reports when this could all be done on computers. If we got bad actions, then they'll pile up on each other. Obviously, there's something wrong with this one officer. Our citizens don't like him. You know, they can go in there and they could write the reports, push in. I'd like to write my own report about what it was. Or they could look at the report that the officers and make corrections. The whole thing is we don't get back to these people if we don't know what they're feeling. And this is what the problem that I've had as a victim of the Sheriff's Department. Is nobody gets back to you. They don't really care. They've created it. They've created this problem, and you have to live with it for life. And then they sit there and they just dwell on it. And I'm tired of that. We need this citizens overlook on the Sheriff's Department. And we need this here, and we need it in our cities. Because otherwise it isn't going to stop, and then you're going to be training the same people that turn around are making the mistakes, are training the new officers. And then what do you get? A duplication of the same problems because we haven't corrected them. It's going to take us to correct these things. Maybe you guys don't want to see it, but I'm a victim. I've had surgeries. I got 3 more to do just because I went over to take a picture of my empty rental units. And that's what I get. And my family turns around. My daughters have to see me beaten, thrown in a hospital. But nobody cares. Nobody cares. And we got to stop this. And if I have to come in here and talk every time and even run for that guy's position in my district, I will do it. I will do it because we have to resolve this problem. It hurts me inside to see that this is the way we have to live. You know, am I supposed to turn bad? Or am I supposed to look at you guys and say, let's make something better? That's all I want to see. And second thing, I have one more other thing, is our poor. We're dumping money and money and money, and then we're letting them just pile up and garbage. We can't control that. With all the money that we have, we should be able to control that. We ought to make it safe for them. We ought to give them places. It's simple as making an S. Maybe you don't understand that. But as a builder, I'm a builder. And if we'd go down the line and say, look, these people are moving down this line. It's basically 99. They're coming from Turlock. They're going back there. Now we have all this track surface, and we spent a lot of money down here putting in the little bike things and everything. But if we make little S things, officers, community officers can come by and look at safety. They can stay in one section of the S. They drive this way. They can see what's going on, the safety of those people. If they come down the road the opposite way, they can see the safety of those people. They can stop it and they can talk to them. We can keep the garbage cleaned up, and they'd all have a little safe section within the S. And we just put this up and down. It's really easy. We got digital builders now. We can turn around and put a robot out there to build these little S's. You know, it's really cheap, $199,000. You got a machine that just produces these little S's for people to live in, stay in. And then we need stops. We got one end of the county here, one end of the county here in our city. It seems pretty simple with the amount of money we have that we can't put together a place where they can feed, they can turn around and wash themselves, they can meet social workers, they can turn around. Maybe they're scared to go to court. We can put them in there. They can stop in and say, here, let's help you. We're not just going to throw you in jail. And this is what we need. Our community's got to change. You know, otherwise you're just beating us down. Guys like me, you're beating us down. We need changes. And I hope that you guys can make these changes. Otherwise, what I have left? Run for his position next. You know, sit up there with you guys and let's make the changes. I would love that. I'd love to work that way. I've been in this county my whole life. I love this county,
Thank you very much.
but I don't like what's happening.
Next up, we have Miguel Donoso, and then Miguel had given us a piece of paper to follow along with.
Good morning, Mr. Chairman.
Good morning.
Members. You see in the next page, there's a document. I was in front of the Board of Supervisors, especially with Mr. Whitrow, when he was the chairman of CHAS. So this is not new what I'm presenting to you. My issue is the continuing care in CHAS. CHAS not have the legal authority in this county. It's not supposed to be here. It's not supposed to be created by the county. That was a wrong mistake, and it's a big mistake. according to these federal guidelines, the only authorized is the continual care. And then you have a lot of conflict of interest between the members, even Mr. Whitrow, this member of CHAS, and at the same time is a member of Board Supervisor, and then come back to the continual care, and then come back to the Board Supervisor to see the same numbers of the approvals and programs and funding. And then you have in different pages the different members that are continue to be conflict of interest. And the county council is still acting like, no, the bylaws say that you guys can be there because you guys not receive direct funding. But you see the guidelines of HAT, there's the federal guidelines, the control and advise and have the policy for continuing care say, no, you cannot be set in one board and then another board and at the same time see the same number before the other board. In this case, CHAS, me before a continuum of care. And then Mr. Whitrow is there, and 3 more members are there set from the continuum of care. So when you come back to the next 2 weeks to the meeting of continuum of care, the staff does the same report. And then come back to the board supervisor and approve the same report. So very different status and different contradiction. And Mr. Hayes created this council of CHAS and put it to the board supervisor, and the board supervisor said, yes, it's beautiful. And then even almost appoint Mr. Whitrow to be part, and then he is the alternate. So again, it's a nice conflict of interest because he's the man that's supposed to be the alternate of Mr. Whitrow. So there's a lot of conflict in there. But the county council continued denying and say no, because it's according to the bylaws of CHAS and no conflict in there. According to the continuum care and not conflict in there. But according to the federal, where you receive the money, it say no, because you have the influence and complete conflict of interest not only of the board of the continuum care, but at the same time it's an organization. So you have 2 conflict of interest. Thank you very much.
Thank you very much. Next up, we have John Mataka.
Sounds like if we just get that evil Mr. Wither off, everything would be fine in the county.
Good morning. My name is John X. Mataka, and I'm the president of the Grayson Neighborhood Council. Can you hear me?
Yes, sir.
And a member of Valley Improvement Projects in Modesto. I have 3 issues to bring to your attention this morning. The first issue deals with a 15-year-old Latino adolescent who was incarcerated at juvenile hall for 10 days after his mother called serious police after her son stated, quote, he was going to run away again. Her son is a special needs individual and is partially paralyzed on the right side. I and other community members were asked to intervene in this issue by the parents due to a language issue. I contacted the Juvenile Public Defender's Office to ask if they had a Spanish-speaking lawyer due to the fact that this young man's parents spoke Spanish. I was told that there are, quote, no Spanish-speaking lawyers, and if a Spanish-speaking person calls, one clerical staff deals with them. This is unacceptable due to the clerical staff not being a certified or registered interpreter. A language access specialist goes through 20 weeks of training and then an internship. To leave this task to a clerical staff is a disservice to the parents and the juvenile due to his freedom being at stake and the issues being legal issues, not just appointments, etc. Second issue. This past Saturday, there was a fire at the Covanta incinerator. This is the second fire at that site. Covanta is 30 years old and has many issues, and many issues arise when incinerators get older. There are only 2 incinerators in California, Stanislaus County and Long Beach. The Long Beach incinerator is going to invest $13.7 million to make necessary repairs. Incinerators undermine state goals around recycling, composting, and preventing waste, and are expensive to maintain. The west side of Stanislaus County has historically been the dumping ground for incineration, i.e. the tire incinerator. We do not want the Covanta contract renewed, and we want a recycling plant in its place. I would encourage this board to join concerned citizens in a field trip to view other recycling options. Third issue, zip code 95313 encompasses Crow's Landing, had an opiate-related death rate of nearly 115 people per 100,000. We know that Crow's Landing community doesn't have 100,000 people, but that's due to the population. It's the highest. In an article by Christiana Mink, a pediatrician and freelance reporter, Hickman has a death rate of 58 per 100,000. In Crow's Landing, 1 out of 7 people live at or below the poverty level. In this article, Mrs. Mink questions whether COVID-19 played a part in these high death rates. Dr. Mora of Behavioral Health and Recovery Services stated in the article that there are no prevention programs targeting specific neighborhoods. I ask you all, why is that the case? BHRS has a prevention program, and this certainly should be a huge concern to them. The COVID-19 funding you receive includes money for mental health services. In a 6-month survey we have completed, covering the whole west side of the county, mental health services was mentioned as a need for increasing services due to the COVID-19 pandemic. And in closing, I will say this. I spoke with Ruben Imperial, the director of BHRS, prior to the meeting. He has assured me that although they have a huge deficit in the mental health budget, that he's concerned about these issues, and he says he's willing to meet and to find some way of dealing with these issues. Thank you very much.
Hey, John, can I ask one question? It was the Public Defender's Office?
Yes.
You spoke with
the Public Defenders of the Juvenile Division.
The Juvenile Division, okay.
Yeah.
Let's see, because we have, any of the interpreters have to go through a class, I believe, right?
Yeah, well, it's not necessarily a class. I do want to just state for the public, and thank you for your comments, we will follow the Public Defender's Office to ensure that their translation services are meeting county requirements and policy procedure. We do have a significant portion of our county workforce that is identified as being competent and qualified for bilingual services, a variety of bilingual languages. They are tested. I just wanted to make sure that that was clear, that we do test our bilingual staff to ensure competency before they fulfill those services.
Yeah, I understand that, Jody, but the issue is this. We're not talking about when you come for services to the county and having somebody that speaks your language enough to get you in the door and get you what you need. We're talking about legal issues that are going to determine whether a juvenile is incarcerated or not incarcerated, and his life and what happens to him getting into the system. So that's a little different. When you go to court, they have these interpreters that I'm talking about. Why do they do that? Because they want to ensure that you fully understand and that what is being interpreted to you is correct beyond a shadow of a doubt. Well, this should be no different for a juvenile. When he comes into the system and I speak Spanish and my child's in there, I should have somebody, just like a court reporter, that has those qualifications to tell me what's going on with my son from that legal standpoint. So that's all I have to say. Thank you.
Thank you for your comments. Do we have any, do we have any other comments? Those are the last speaker cards I have. I'll ask the clerk, did we receive any public comments?
We did not receive any written public comments for the public comment period. We did receive some for an agenda item later on the agenda, item 7.7. I'll be passing that out.
Okay, thank you very much. So we're going to move on to item 6, the consent calendar, reminding everyone B11 has been pulled. I also have a speaker card. Someone wants to speak on item B10. Do any board members want to pull any items? Okay, so I'm going to call the speaker up. Since we're not going to pull the item, it's Kyle Kowalski. How about that? I always say it. I'm supposed to wear glasses, but I'm too vain up here, so.
Yeah, you got it right. No
I admit
worries.
it. Sorry.
Good morning, Supervisors. Again, my name is Kyle Kowalski. I am a carpenter's field representative for Local 152 in Manteca. And again, I'm here to speak on item 10, the Bonita Pool Project. Simile Construction Services and DD Construction, Inc. do not pay area standard wages and benefits and do not provide health care on all of their jobs. They use our public funds to subsidize their own projects. In the era of COVID, we have realized now that it is more essential now that health care is more important than ever. Let us not make the decision to award the contract based on price alone, but on being a responsible contractor. Simile and DD are not responsible contractors. Thank you for your time.
Thank you very much for your comments. Anyone else? Okay. Bring it back to the board. Consent calendar.
I'll make a motion to approve all consent calendar items with the exception of item 11.
The 11. Do I have a second? Say it in that mic so they can. Supervisor Condit, second. Okay. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Thank you. Before I move on to the next item, I just wanted to introduce Deputy Cummings in the back. First meeting, first time he's been in here. Patrol Deputy, thank you for being here. Appreciate it. Okay, now we're going to go through some public hearings. I was going to lick my finger, that didn't work. First one is item 7.1, public hearing to introduce and waive the first reading of an ordinance to amend existing fees for the Department of Public Works. Frederick and Dave will be presenting.
Thank you, Chair Chiesa. Well, good morning, board members and CEO Hayes and Thomas Bose, County Council. I brought Frederick Clark to answer questions. We'll try to keep it brief. There's a bunch of public hearings, and this one seems fairly simple. So,
Unless you're paying it.
Right. That was the only comment we received was local architect said he didn't like fees, and I think we agree with them for the most part. But they're necessary. Why update fees now for public works? Fees were last updated in 2018. Existing fees aren't covering rising costs. Public Works is requesting an inflationary update to keep pace with rising costs. And Public Works next year with proposed budget will ask to spend some money doing a comprehensive fee update for fiscal year 21-22. The index we used is a common one. It's been used since 1913. It's the Engineering News Record 20 Cities Construction Cost Index. Local engineers, architects, builders all understand and know this index, and it seems appropriate for public works. The ENR's Construction Cost Index results in a 6.89% fee increase based on our last one. And so we, like I said, we did have local land use professionals look at this fees update. We got one comment, and we sent it to the BIA, received minimal comments. And just thought I'd highlight what our rates look like compared to some of our 8 comparable counties. We're proposed at $102 an hour. Fresno County, the last time they updated was 2008. They're $70 an hour. Madera County's $186. San Joaquin's about 116, and Merced County's at 98. So we're kind of in the range of our peers. And so staff's recommending that the board hold a public hearing to introduce and waive the first reading of an ordinance to amend our existing fees for the Department of Public Works. And Public Works staff are available for questions from the board and public.
Any questions from the board for Public Works? If not, I'll open up the public hearing. Opportunity to come and speak on this item. Seeing none, I'll close the public hearing, bring it back to the board.
I will make a motion to approve staff recommendations.
Second.
We have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0.
Thank you very much.
Thank you. On to item 2, public hearing to introduce and waive the first reading of an ordinance to establish new fees and amend and eliminate existing fees for the Department of Environmental Resources. Patrick Kavanaugh. presenting.
Yes, Patrick, how's the new job going?
It's going very well, so I appreciate the opportunity. I think I'm about 57 days in, not that I've been counting, but luckily there's great staff at Environmental Resources who make sure I don't do anything too disastrous while I'm out there. So we're keeping the ship afloat, and we're not going through any canals because we know what happens when you take a big ship through small canals. So good morning, Chairman Chiesa, members of the board, CEO Hayes, County Council Bose. My name is Patrick Kavanaugh. I am the interim director of Environmental Resources, and joining me today are our two assistant directors, Mandeep Dillon and Janice Min. They'll be doing the bulk of the presentation on our fees. We'll try to move along as quickly as possible, but I don't think we'll be as quick as Dave in Public Works. So this morning, our recommended adjustments include an adjustment to the weighted labor rate, the addition of a credit card surcharge, and fee adjustments to related to hazardous materials, environmental health, and the Fink Road landfill. These adjustments are necessary to cover the rising program costs. Today, we're recommending to eliminate environmental health related fees. These fees listed on the screen are recommended for elimination for several reasons. Either they're not utilized, they're being consolidated into a single fee category, or no longer necessary due to the recommended use of a weighted labor rate. Some new fees. We'll begin with the credit surcharge. The department is proposing the addition of a new credit card surcharge of 3.5% to cover the cost of bank services, charges, and or merchants' fees added to credit card transactions by credit card companies. And then within the hazardous materials CESQG program, staff is proposing to add new categories to the fee schedule for toxic solids, toxic liquids, flammable liquids, oxidizers, acids, bases, and bulk oil sludge. So that's it for me, and I'll now pass it over to Janice.
Good morning. Within environmental health, staff is recommending a number of individual fee categories be consolidated into a well permit modification / transfer / cancellation fee and be charged a minimum of 1 hour at the weighted labor rate. A similar modification is recommended for the on-site wastewater treatment programs. It is also recommended to create a fee for the annual detention facility inspections and reports the department engages in on an annual basis and for activities associated with regulating organized camps. In the landfill division, it is recommended to add new fees for the acceptance of microwaves and compressors. And moving on to amended fees, it's recommended to amend a number of fees, including the department's weighted labor rates. It's recommended to increase the weighted labor rate, the department's overall weighted labor rate, by $3 per hour, and the clerical weighted labor rate by $1 per hour. Within environmental health, staff is recommending a food fee description name change to align with the current regulations. Additionally, staff is recommending increases in the food, liquid waste, and waste programs as listed on the screen. If approved, the proposed fees will lessen the deficit in these programs. Within the landfill division, staff is recommending an increase in appliance disposal fees. Lastly, staff recommends increasing the waste-to-energy ash tipping fee according to the Consumer Price Index.
Thank you, Janice. It's always easier to be back, in the seats than to be up here for whatever reason. But I'll try to do my best here. Within the hazmat division, we're recommending to increase underground storage tanks related fees by 15%, as well as to increase the plan review fee from a 3-hour minimum to a 7-hour minimum based on our current experience. This program, we serve currently 207 facilities and about 611 underground tanks. Additionally, within the hazmat division, a 20% fee increase is recommended for the farm disclosure annual inspection fee. Currently, we serve about 401 farms in this program. In addition, we are recommending a 20% increase in the household hazardous waste, the small quantity generator. This program serves about 130 small businesses that bring waste materials to the household hazardous waste facility. It's important to note that even with this increase, there'll still be a deficit in this program, and gradual fees will be needed in the future to fully clear the deficit. And we've enclosed a detailed schedule showing all the fee increases being proposed here by the department. It's included with the agenda item. So the department did a due diligence, conducted public stakeholder meetings on March the 11th, 2021 to provide information, receive input on the fee proposals. Overall stakeholder feedback from the two workshops was favorable to all the proposed changes in the fees. Public notices for the March 11th workshops were published in the Modesto Bee on February 28th and March 1st, 2021. And the proposed fees were also posted to the department's website on March 11th, 2021. So in conclusion, we have one staff recommendation, which is to introduce and waive the first reading of an ordinance to establish new and amend or eliminate existing fees for the Department of Environmental Resources. If approved, these fees will be effective June 24, 2021, with the exception of the landfill fees, which will become effective on July 1, 2021. So that's our presentation. Thank you.
Perfect. Any questions of staff? So before I open the public hearing, I know it sounds like we're not asking questions, but we've all been briefed on every one of these, and all of our concerns have been addressed along the way. We always say that, but we are briefed to death generally when it comes to fee increases. So I just want to point that out. Supervisor Condon.
Thank you, Mr. Chairman. Back on the hazardous, the UST review, the change from 3 hours to 7.
Yes.
If it doesn't go 7, we don't charge 7.
Correct, yeah, so the minimum, let me see. Yeah, I believe we charge the actual fee for whatever we charge.
Okay. Perfect. Okay, no more questions? I'll open the public hearing. Please come forward if you have any comments, questions. Seeing none, I'm going to close the public hearing, bring it back to the board for action.
Just going to add one more, just to reinforce it. Yeah, we've all been briefed on this. Nobody likes to increase fees, but we're not in this to make a profit. We do this just to cover our costs. And as you see in some of the descriptions here, we're still not covering our costs in these fees. But that's what the fees are about, covering our costs. So I just want to reinforce that. Besides the briefings, we all go through all this stuff, and we're going to have a few of them here today. Yeah, it is about cost, recovering costs for the county. So anyway, I just want to thank Patrick and Janice and Mandy. Good job.
Yeah,
thank you, guys.
all. Okay. Motion?
I will make a motion to approve all staff recommendations.
A second.
This is getting old, isn't it?
I know, sorry, I cut off Buck. Sorry, Buck, I cut you off.
All right. All those in favor say aye.
Aye.
Aye. Opposed? Motion carries 5-0. Moving on to item 7.3, public hearing to establish and waive the first reading of the ordinance, establish new fees and eliminate existing fees for commercial cannabis activities. Tara Chumley is presenting. With Kristen Dowd, maybe.
She joins me with PFF.
Got it.
We're moving pretty good on this stuff.
Mm-hmm.
All right, good morning, Chairman Chiesa, Supervisors, CEO Hayes, and Council Bowes. I'm Tara Chumley with the Chief Executive Office, and I want to give you a quick update for the commercial cannabis activity fees. In 2017, the board adopted ordinances related to regulating commercial cannabis activities, which included establishing new fees related to regulation. Fees were established for processing cannabis business applications, background investigations, life scanning, security plan inspections performed by our Sheriff's Department, annual business permits, and track and trace program fees. At program inception, the Ag Commissioner was tasked with overseeing the county-wide track and trace program, and fees were established to implement an effective program for Stanislaus County. Since then, the state has implemented a statewide inventory system known as Metric, and this tracks all commercial cannabis and cannabis products from cultivation to sale. In May 2019, the Board of Supervisors approved the Ag Commissioner to enter into a cooperative agreement with the CDFA to conduct compliance inspections of cannabis cultivators, nurseries, and processors. The County Ag Commissioner is reimbursed at a rate of $400 per inspection. As a result, the county track and trace fees previously adopted by the board have not been implemented, and it is recommended to eliminate these fees. The Chief Executive Office has received requests to make amendments to approved development agreements related to the commercial cannabis activities, such as adding additional owners, requesting to renegotiate flat rate fees, amending development schedules due to construction and permitting delays, or adding additional permit uses. The Planning and Community Development Department collects a fee for new development agreements that charge actual costs with a minimum charge deposit amount of a little over $6,500. This fee includes staff time for planning, public works, environmental resources, clerk of the board, and various other county activities related to the development agreement. Chief Executive Office and County Council staff time associated with the original negotiation of the fees included in the development agreement are captured with the applicant's original application processing fee. The cannabis program does not currently have a fee associated with amendments to approved development agreements. Staff associated with non-land use related amendments to approved development agreements include the Chief Executive Office, County Council, and Clerk of the Board. It is recommended to add a new fee for development agreement amendments charging actual costs with minimum charge deposit, similar to the Planning and Community Development fee schedule. Using weighted labor rates of associated staff, it is estimated that a minimum of 16 staff hours would be needed to amend development agreements for a total minimum charge deposit of $2,082. Time spent beyond the estimate will be charged actual costs. So staff recommends that you open the public hearing to introduce and waive the first reading of an ordinance to establish new fees and eliminate existing fees for commercial cannabis activities. I'm happy to answer any questions you may have. Thank you.
Any questions with Tara? Seeing none, I'm going to go ahead and open the public hearing. Please come forward. Comments, questions? Seeing no one, I'll close the public hearing, bring it back to the board.
Make a motion to approve staff recommendation.
I'll second that motion.
Thank you. We have a first and second. All those in favor say aye.
Aye.
Opposed? Motion again carries 5-0.
Thank you.
Thank you. Moving on to item 7.4, public hearing to consider the adoption of the updated county public facility fees program to amend the accessory dwelling unit fee structure and amendment to the PFF administrative guidelines. And Tara and Kristen will be presenting today.
All right. Good morning again. Tara Chumley with the Chief Executive Office, and with me is Kristen Dowd from Planning and Community Development Department. We're here today to provide you an update to the accessory dwelling unit fee, otherwise known as ADU. In April of 2019, the Board of Supervisors approved a new accessory dwelling unit fee category to the PFF program. An ADU is described as a second attached or detached unit to existing single-family residence. Previously, the multifamily rate was charged for ADUs, and the new approved fee category provided a lower flat fee using a one-person occupancy rate. ADUs offer a variety of benefits to communities by increasing housing supply, affordable housing options for many low and moderate income residents, including elderly and or disabled persons, who may want to live close to family members or caregivers, empty nesters, and young adults just entering the workforce. It also provides homeowners extra income that can assist in mitigating the increased cost of living. The new ADU fee category included certain criteria of a maximum size of 1,200 square foot, no more than one ADU per single-family lot. The property owner must occupy the primary single-family residence or ADU, and the design must be consistent with the main residence.
So in 2019, effective in 2020, the State Department of Housing and Community Development has updated the ADU regulations, which eliminated the owner occupancy requirements until January 2025. It also limited architectural standards to objective standards only and required that ADUs that are 750 square feet or less be exempt from impact fees, and required that any impact fees be charged at a proportional rate to the main dwelling unit. The formula shown calculates the ADU impact fee using proportional methodology as required by the state. Looking at the examples provided using this proportional calculator, you can see that essentially the larger the main dwelling, the lower the impact fee. And conversely, the smaller the main dwelling, the higher the impact fee. For example, if a main dwelling is 1,600 square feet in size and the ADU is 1,200 square feet, the impact fee would be $7,629 using the proportional calculator, which is double, a little over double, the current flat rate for an ADU. Staff is recommending that the ADU impact fee calculation be amended to align with the state using the proportional calculation methodology reflected above. However, when the proportional calculated fee is more than the current ADU flat rate, we recommend a lesser fee be charged.
So staff recommends that you open the public hearing to consider the adoption of the updated County Public Facility Fees Program to amend the accessory dwelling unit fee category and amend the administrative guidelines to reference the requirements included in the adopted ADU ordinance of the Stanislaus County Code. And with that, we're here to answer any questions you may have. Thank you.
So I want to thank you guys for catching that. And if you move it back 2 slides, or 1 slide, I'm sorry, I think this is very important. And the state calculation, the way the state wants it done, there's the potential for people to be charged more than our current fee. And so, and speaking with Tara and Kristen, they had realized this early on, and so we were able to adjust it or come with a recommendation that it is the right-hand fee or the state methodology or the current fee, whichever is lower. I'm saying that right?
Mm-hmm. Correct.
Which is really good. It's as we are trying to encourage, not discourage, people to put in ADU. So anyways, I appreciate that. Any questions, comments?
I'm just going to just second what you said. This is a no-brainer, and I thank Christy and Tara for doing this. Thank you guys for catching this and doing this.
Yep, appreciate it. You're welcome. All right, I'm going to open the public hearing. Come forward. Any comments, questions? Seeing none, I'm going to close the public hearing, bring it back to the board for action.
I'll make the motion.
Second.
We have a motion. We have a second. All those in favor say aye.
Aye.
Opposed? Motion again carries unanimously. Moving on to item, thank you very much. Moving on to item 7.5, public hearing to introduce and waive the first reading of the ordinance to amend existing fees and planning services, planning and community development. Sam Graves and our fearless leader.
Good morning,
Hey, how are
Chairman Chiesa, members of the board, Mr. Hayes and Mr. Bose. I'm Angela Freitas, County's Public Planning Director. About to forget my title here. And with me this morning to present this item, which is an amendment of existing fees, is the department's Deputy Director, Sam Groves. As we get the item up. Okay. So back on May 15th of 2018, the Board of Supervisors approved a user fee study that was prepared by Matrix Consulting for planning services. The fee study included a total cost analysis of all the planning service fees and provided a comparative survey of the various counties and cities. The study identified 2 options to update planning service fees to ensure continued 100% cost recovery, those options being to utilize a consumer price index, a CPI, or other regional factor to update the cost calculation established in the study on an annual basis, or to use the county's anticipated labor cost increase, such as step increases, benefit enhancements, and cost of living raises. As part of the 2018 update, staff recommended using changes in the calculated weighted labor rate as the basis for annual fee updates, and that has been the approach that we have taken each year since, and it is the approach that we are proposing this year. Based on changes in the calculated weighted labor rate, the department is proposing a 3.4% fee increase on all flat rate fees. The increases range from $2 to $137 per application. Some examples of the fees based on the most common permit types that we have are parcel maps without Williamson Act going up $114, agricultural use permits $117, and use permits requiring board action would go up $137. We are proposing no increase to the deposit-based fees. In addition to the 3.4% increase, the department is proposing the 2 following fee increases: a $90 increase in the Planning Commission clerk charge to cover the increased costs of public notices in local newspapers, and a change in the Surface Mining Reclamation Act SMARA determination from a flat $511 fee to a deposit-based actual cost with a minimum deposit of $1,000. The planning services fee schedule includes fees collected by the planning department for environmental resources, public works, and the clerk of the board. The fee increase proposed this morning by Public Works and DER are reflected in the proposed fee schedule, which is attached to your item. And as part of this item, the clerk of the board is also proposing a $90 increase to cover increased publication costs for rezone and Williamson Act cancellation requests that are presented to the Board of Supervisors. In addition to services with the fee, the department's planning division continues to offer pre-development meetings and to have planners on call for general inquiries at no cost. The goal in offering these services is to help facilitate the development process through early identification of potential issues and direction on the process or application needed for development to occur. Notice of the proposed amendments to the existing fees were provided to regular representatives and applicants seeking planning services, the Stanislaus County Farm Bureau, the California Building Industry Association, and no comments or concerns have been received by the department. Staff is recommending that the Board of Supervisors conduct a public hearing to introduce and waive the first reading of the ordinance and to amend existing fees for planning services. If approved, these would become effective July 24th of 2021. And staff is available if there are any questions.
Perfect. Any questions of staff?
Just real quick, I guess the last time we did this was July of 20, right? The last adjustment. But I think prior to that, several years had gone by. Is that right? If I recall, we had a period of time since we'd had increases.
Since 2018, we have been to the board annually with the weighted labor rate increase.
Right.
Prior to that, there had been a 10-year period where fees had not been adjusted.
Exactly. So I just want to make sure that we point that out so people realize it. And I think that was us saying, let's do this every year and not have it 10 years go by before we have this giant increase. So just for those who weren't here at the time, that's why it doesn't, we're not doing this every year. There was a long period of time where we had no adjustments, and this is as a result of direction from the board to let's start doing this annually. So I just wanted to point that out.
And planning and community development is not a general fund department, to speak of. It is funded through fees, and generally the next item is
Planning
like
services is general fund.
Yeah, it's the next item, the building fees.
Correct.
And
I'll just take the opportunity to say with the next item on building services, last year was the first year in 10 years that we had adjusted those fees.
Yeah, very good. Any other questions, comments? Seeing none, open the public hearing. Come forward. Any questions, comments? Seeing none, close the public hearing. Bring it back to the board.
I'll make a motion to approve all staff recommendations.
It's a motion.
Second.
And a second. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. make sure you interrupt me when we come to the item where there's some public comment. Okay. Looks like we're going to stay with Mr. Groves again. So we're moving on to item 6, public hearing to introduce and waive the first reading of the ordinance to amend existing fees and building permit services. This is the one. Planning Community Development. Angela.
Yes, good morning again. I'm Angela Freitas, the county's planning director. Building Permit Services oversees the administration of building permits for the unincorporated area, including enforcement of abandoned and dangerous buildings. Building Permit Services has oversight of the county's one-stop shop permitting process, which is a partnership between the Planning, Public Works, Fire Warden, and Environmental Resource Departments. Part of the one-stop shop oversight includes the responsibility of calculating and collecting county public facility fees. Building Permit Services is 100% funded by fees, 90% of the fees being valuation-based and 10% being flat rate fees. The last comprehensive update to the Planning Permit Services fees was adopted in 2020. As with planning services, based on the change in the calculated weighted labor rate, the department is proposing a 3.4% fee increase to all Building Permit Services fees. The proposed fee increase reflects increases in salary amounts, health care, and general operation costs, which can no longer be sustained under the existing structure without use of fund balance. 90% of the Building Permit Services fees are valuation-based. Valuation-based fees equal the construction costs times the permit fee multiplier. The multiplier is based on the percentage of the budget expected to be provided by building permit revenues. The value of construction used in determining the fees is based on building valuation data, a BVD, published every 6 months by the International Code Council. The data is based on market value averages of construction costs throughout the United States. The department currently uses the the February 2018 building valuation data, which is the version adopted as part of the 2020 fee update. The department is not proposing any change to the building valuation data being used since market conditions have not changed since the 2020 update. As with flat rate fees, the department is proposing to increase the multiplier value associated with the percentage of department costs by 3.4%. The slide before you reflects a comparison of existing versus proposed fees, both flat and valuation-based. The highest dollar fee increase being $172 for a single-family dwelling based on a 3,300 square foot dwelling with a 1,350 square foot garage and a 740 square foot patio for a total permit cost of $5,224.34. The lowest dollar fee being a $4 increase for a water heater replacement for a total cost of $130.57. As with the planning services fees, notice of this amendment to the existing fees was provided to regular representatives and applicants seeking building services, Stanislaus County Farm Bureau, and the California Building Industry Association. No comments or concerns have been received by the department. Staff is recommending that the Board of Supervisors conduct the hearing to introduce and waive the first reading of an ordinance to amend existing fees for building services. And again, if approved, these fees would become effective July 24th, 2021. Staff is available if there are any questions.
Perfect. Any questions of staff? Seeing none, I'll open the public hearing. Come forward. Questions, comments? Seeing none, close the public hearing and bring it back to the board. There are no comments on this one again? Okay. Look for a motion.
Making a motion to approve staff recommendation.
Okay. A motion?
I will second, this is so fun, I will second this.
Okay. Motion is second. All those in favor say aye.
Aye.
Opposed? Passes unanimously. Thank you very much.
We're rolling, we're making progress here.
On to item 7.7, approval to close the 30-day public review period and conduct a public hearing to consider approval of the Stanislaus Urban County fiscal year 2021-22 annual action plan and the filing of a notice of exemption. Angela Freitas and Anna.
Good morning again. Happy to transition from fees to something different. So our annual action plan, this is an annual action that we bring to you addressing our Community Development Block Grant and Emergency Solution Grant funds. Anna Stanislaus, our Community Development Manager, is going to lead us through this presentation.
Good morning. Before you have the Stanislaus Urban County
which consists of Stanislaus County and 7 of the 9 cities. We serve, and we're entering into our, I believe, 21st year as a HUD entitlement jurisdiction, and Stanislaus County, again, serves as lead agency on behalf of those 7 cities. City of Modesto and City of Turlock receive their own respective entitlement funds. So we take a regional approach, and we have community development block grant funds and emergency solutions grants program funds that is utilized throughout the urban county. We developed a 5-year plan that was last approved May of 2020, and the annual action plan is actually the 2nd year for the work plan to achieve the goals listed in that consolidated plan. Now, the City of Turlock is our lead agency for our home funding, which consists of affordable housing programs like down payment assistance, rehabilitation, property acquisition. So they in turn are the lead agency over what would be the Stanislaus Urban County and themselves for home program funding. So the plan development for this annual action plan consisted of a variety of, let's say, methods. We were still in 2020 when we started, so a lot of our community meetings and outreach was done via Zoom. So we had a community meeting in joint effort with the City of Turlock for home and CDBG and ESG funds. We also had stakeholder outreach with our service providers and that worked with the CDBG Public Services, ESG, shelter providers, street outreach, and therefore throughout the urban county. We also worked with the Stanislaus Community Foundation, and they had 2 surveys out in 2020. One to talk about, in the spring of 2020, the pulse of COVID and the impacts and the results and the needs in the community. And then there was a second survey done in the fall of 2020 to kind of check the progress and existing needs and, again, help us identify any gaps in services or needs in the community, the clients. We also worked with our city councils for the urban county and the staff to provide outreach and provide some community meetings. Ceres, Patterson, as well as the city of Oakdale were able to have community meetings as well as their city council meetings to talk about their upcoming allocation for funds. And then we also had our county's Community Development Committee, which had supervisors very well and Withrow participate in not just a typical in-person, but it was also via Zoom, I believe. And we had public participation that included some residents and CRLA. So with that, it helped us develop and again confirm some identified needs and priorities in the AAP. So for 21-22, we are receiving 2.4 in CDBG funds and $212,662 for the Emergency Solutions grants. Both of them reflect a slight increase from compared to previous year. So the CARES funding is also mentioned in our annual action plan, not because we are receiving it. We had a substantial amendment to our 2020 annual action plan that was approved by the board on March 30th. We will be reporting the results of this funding in our 2020 end of the year report to come in a few months. But we were authorized to move forward and included as part of our notice of funding availability our grant process for our 21-22 funding. So with that, we have Community Development Block Grant CV3, which is a CARES funding dedicated to prepare, prevent, and respond to CARES impact or COVID impact in the community. So that can be used for public services, and we have 20% set aside for administration of that 1.4. Then we have Emergency Solutions grants, $3.8 million dedicated for program activities, HMIS, the Homeless Management Information System data entry support, and some administration. So again, this will be included in our NOFA process. Now before you is the breakdown for the 21-22 CDBG and ESG allocations for the urban county. Notice each city has an annual allotment that they can dedicate to their infrastructure projects. That has been approved or is being considered for approval in the current annual action plan. Each city also gets a portion for administrative costs for the year. If they do not use it, they don't necessarily lose the funding. It rolls into their infrastructure project. Likewise for Stanislaus County. Now, the allocations are calculated according to population and poverty. Last year we did add an additional city, Riverbank, so it helped us increase our overall amount, but overall we kind of stayed the same. So it did help us increase with additional funding. We do set aside 10% of the overall CDBG allocation for public services. And again, that'll be included in our NOFA process. We also set aside funding for fair housing that is included in our NOFA competitive process for HUD certified service providers to provide that service. And then we have our ESG total for the urban county. Each member has agreed to allow us to administer the program for the urban county, so we put that in our NOFA process. So for the 21-22 annual action plan, each city has concentrated on infrastructure improvements. Likewise, Stanislaus County is allocating their portion for this year to the West Modesto infrastructure project. City of Ceres will be doing a continuation of planning for the Morrill Village area improvement. City of Houston will be beginning the Walker Lane project, as well as Newman will be starting their Hill project. Oakdale will be starting theirs with the Wood Basin Improvement Project. Patterson will be working on environmental design and engineering, as well as Riverbank, and Waterford will be hitting construction in the summer. So, part of the process for the annual action plan is to describe our distribution method, which was again taken on March 30th as a substantial amendment to our 2020 AAP. So with this, we have before you the cumulative total of all our funding that includes CARES funding, the COVID-19 federal funding, and our allocations for public services, minus any state CARES funding. So a total of $6 million approximately, and the priorities that were approved back in March. So the NOFA will be released in a few weeks, and before you will be in about June an item with the funding recommendations as a result of those NOFA processes. Now, the proposed scoring factors that, again, were approved is the capacity and experience will be looked at, how a service provider addresses a need and the extent of the problem. Collaboration is important, and the accomplishments and program evaluation of the grant application. Financials, program assessment, program innovation, and overall grant submittal. Now, the grant review panel consists of a representative of each of the cities in the urban county, as well as the Chief Executive Office and the Continuum of Care. So, again, our public comment period opened on April 9th and ended on May 10th. We have one written public comment that was received last night. We can go over that response.
Yeah, I can go ahead. I think the board members, you all have a copy of CRLA's comment letter that was put before you this morning. It was received late yesterday. It was dated May 10th. It identifies issues, 9 specific issues, calling out what they believe maybe in some cases deficiencies within our annual action plan. And so I'd like to kind of just provide an overview of our response to those comments, which is going to be a little lengthy, but I will do my best to kind of keep it as streamlined as I can. Many of the funding sources, there are a lot of funding sources that are used throughout the county, and there's some criticism within the letter that the annual action plan isn't really accounting for all of those funding sources. The annual action plan is a plan for HUD funding received by the Stanislaus Urban County, that being Community Development Block Grant and Emergency Solution Grants. We could spend a lot of time writing and putting a lot of information into the annual action plan of all the wonderful stuff that's being done and all the funding that we receive, but there are limits on how much text we can actually input into the HUD system, and so we focus our annual action plan on those HUD funds that we actually receive from HUD. So our CON plan for 2025 and our annual action plan for 2021 were approved by HUD using the same approach, and they approved them, so they have found that approach to be acceptable. We do have some flexibility in the narrative, but again, we have space limitations. And with regards to the tables that are in the annual action plan, in most cases, those are restricted where we can only input the HUD funding that we actually receive. So if we tried to put in other funding, the system would just reject it and call out errors. As a consortium member, our affordable housing activities in general are reported by the City of Turlock in their annual action plan, since they are the home consortium lead, and that is the reason why the affordable housing goal is not included in AP 20 goals and objectives. CRLA has identified the need to prioritize infrastructure, and the Stanislaus Urban County is focused on infrastructure, and the county has an ongoing effort to prioritize infrastructure in the unincorporated areas, not only for sewer, but for other infrastructure needs also. CRLA identifies that in the 1920 CAPER there was a lack of performance for fair housing, and I just want to call out that that CAPER reported under the consolidated plan for 2015-2020, which had overestimated by including activities that could not be reported. So there were activities occurring, but based on the activities that could actually be reported, it did look like there was a lack of performance there. This year's annual action plan does identify funding for fair housing and landlord and tenant engagements. CRLA is raising questions on the distribution of funding among the urban county members. As Anna has pointed out, we use a poverty and population calculation to allocate the funding between the county and the 7 cities. CRLA believes that this system does not assist areas with most need, being that 8% of the funding comes to the county, yet it could be seen that the county has the greatest infrastructure deficiencies. We do believe that the current allocation provides equity for the cities. When they decide to join the urban county, they look at potentially losing funding that they would receive otherwise from the state. So they do bring with them funding when they join the urban county, and the system that we have right now we think is equitable. Under AP 60, public housing, we do acknowledge that we missed an increase in the housing authority vouchers that were released on May 5th. This was released after the release of the annual action plan for public review, and we can certainly amend the language to strengthen the collaboration with the housing authority regarding the use of those housing vouchers. Unlike years past, this AAP does not include recommendation on grant awards. The notice of funding availability are still pending release. The funding that we are proposing will provide opportunities to support homelessness and special needs households. So we do think that the areas being called out in the letter will be addressed through applications received and the funding that we are making available. The grant review process does integrate racial equity assessment, and the effects of strengthening racial equity are ongoing, and we will continue the work with the local HMIS lead and with the Stanislaus Community System of Care to improve data and collaboration in that area. In addressing barriers to affordable housing, the county does offer waivers and deferrals, and as reflected in the earlier item that you heard on accessory dwelling units, we are looking for ways to reduce costs. Fees require a balance between housing needs and infrastructure and service needs. Again, we do our best in the AAP to discuss how HUD funding, how funds are leveraged, but we do not address all funding that has come into the community. We believe that the AAP before you this morning is compliant with HUD requirements. Yesterday evening, we did have a community meeting in which we did have a couple of members of the community and a representative from CRLA. As you can see on the slide before you, there was some conversation on AP 15, expected resources, why was other funding not included. And I'm going to actually turn to Anna to go ahead and give kind of an overview on those comments we received last night.
Sure. So the summary before you, the AEP 15, expected resources, is a component of the AEP. what we need to state in there is only the funding that we get contracts for or are applying therefore with the AAP. So anything not to be in contract with HUD is, well, specifically with the county, would not be put in there. And again, without getting drowned in details, it would set up an account specific for that funding and then report specific goals and accomplishments associated with that funding. So anything not really related to our work, we cannot put in there. There is narrative, there's some room for narrative, but again, they limit us to the work that we do, not countywide, but they're always wanting to know about any match or leveraging for any specific projects. There was also questioning on the AP goals and objectives, like Angela had mentioned. It was noted that affordable housing, the goal was not included. And it was included overall as a con-plan goal. Again, we did a joint consolidated plan as required by HUD with the city of Turlock for our home funds. So it is not our, I don't want to say responsibility, but we don't have access to report on any affordable housing. We can talk about it, but none of our funding is dedicated for CDBG to specifically affordable housing. If it were, we would have to find a way to report it through the home consortia. And then it was also asked what types of infrastructure projects are eligible and how to get funding. The need for sewer hookup, specifically Herndon Road and Aurora Street out in Ceres, and if there's any funding for sewer hookups and alternative means for using poverty and population, again, the distribution of urban county funding. So staff did talk about programs for sewer hookups that could be available with the housing authority that we work with to administer that. And as well for infrastructure projects, the prioritization that's been stated by the board was explained to the people that were participating in the community meeting yesterday. Now, what staff has before you is following recommendations: to close a 30-day public review period that started April 9th and closing today with our public hearing, and to conduct a public hearing and to move forward on the following approvals: the CEQA notice of exemption, to have that filed by staff, and to submit the fiscal year 21-22 annual action plan. Also, the authorizations that follow: authorize the Director of Planning and Community Development to sign the HUD program certifications, authorize the Chief Executive Officer to sign CDBG and home subrecipient agreements for our funding, authorize the Director to sign any related HUD agreements, contracts, or documentation for implementation of these programs, and authorize staff to document any feedback received and incorporate any changes required by HUD. And finally, authorize staff to submit all final HUD documents to HUD.
To HUD.
Any questions?
Okay. Really quickly before, I do want to acknowledge the 12-page comment letter that we received this morning from California Rural Legal Assistance. I'm glad you addressed that. I would, because I think there's great purpose here. There's things in here that, again, they're catching some of our mistakes. I just asked California Rural Legal Assistance not to send it at 5:01 the day before, and then us receiving it today. It's very hard for us to incorporate that into our decision-making to read this. I appreciate you, Angela, for obviously staying up late or getting up early and going through this and addressing all these concerns, because it makes it difficult on us. But again, I appreciate the letter and what's in it. I just ask that it get here a little bit sooner. So any questions of staff? Seeing none, I'm going to go ahead and open the public hearing. Please step forward. Comments, questions? Seeing none, I will close the public hearing and bring it back to the board for action.
Just a quick question. There's nobody here from CRL. I'm sorry. Nobody here from CRLA. Do we have?
Yep.
I just wanted. Did you want to make any comments or anything, or? Okay, if you want to come.
Okay, I'm going to go ahead and open the public hearing back up. That's not a problem. That's quite appropriate. Thank you.
Very briefly. No, thank you very much. I'm Catherine Robinson. I wrote the letter, and I do acknowledge and apologize for the lateness of the letter.
Do not apologize. Okay, just next time, because you're stretched thin like we're stretched thin.
Well, and there's so much, there are obviously so many activities going on in the county, so many documents to go through. We want to make sure we're providing the most comprehensive and helpful comments that we can. And I also want to thank Angela and Anna so much for their courtesy throughout the process, for walking me through the different documents and requirements, so to help put together these comments, because we really are on the same page. So definitely just want to be available for questions. There really aren't any additional comments beyond what our written comments are here.
And I just want to, Catherine, thank you. Thank you for the letter. We think this is great. And I just think it's a new day kind of here now. And I think we, like you said, we're all on the same page. I love on your head, fighting for justice, changing lives. I think that's what we do. We're always fighting for justice and changing lives is what we're trying to do here too. And I know in our community development committee meeting that we had, I think it was a Zoom meeting, I think Mandy and I were on that we were all on that. And I just think that we're all, like I said, we want what you want. We all want the same thing, and we're all working together. And we appreciate the letter, and appreciate you stepping up here and talking this morning. But we're all rolling in the same direction. It's just about how we get there, where we get the funding to do that. And I think it was great in our meeting that we had, our Zoom meeting, that we talked about. We made you guys aware of everything else that was going on. We just look at our annual action plan here, but we talked about everything else that we're working on too, that we want to partner with you guys in all these things. So I just see great things coming here in the future, and I appreciate you being here again. And I don't want people to look at this letter as like a bad thing. These are all things that we're aware of or that we're working on together, and we appreciate. It's good to put it down in writing. That helps sometimes to get things moving along. And like I said, I think we're partners now, and we're working with you guys. At least that's my perception, and I hope it's yours also, that we're working together to try to accomplish the same goals. So.
Absolutely, yeah. Thank you so much for that. And if I can be available for questions even after this, my email contact information is on there, so please reach out.
We're definitely stronger together.
Thanks, Catherine.
Thank you.
Okay, so anyone else for comment? I will close the public hearing again and bring it back to the board for action.
I move to approve item 7.7.
We have a motion.
I will second that.
And a second. Okay, all those in favor say aye.
Aye.
Opposed? Motion carries 5-0.
Thank you very much.
Appreciate. I'm going to announce item 8, but I'm going to give 1 minute if anyone needs to run to the bathroom. Sit here. Okay. Item 8, which is up next, will be consideration and the approval of the third quarter financial report for fiscal year 2020, 2021, and related items. Patrice Dietrich and her team. This looks like Jewel right now will be presenting. If you could just hold off for just a few seconds. This is where you use this thing, Terry. We can go ahead and move ahead? Or no, Jody's going to start.
I'll just do a very quick introduction. And once again, good morning, Chairman Keyes and members of the board. So traditionally, our third quarter financial report has been submitted to the board as a consent item, focused on making any of our necessary technical adjustments to ensure county departments end the fiscal year in a positive position. This year, with the additional complexity of some of our COVID financing issues, we thought it was important to give a small presentation highlighting our recommended budget adjustments today. We continue to move swiftly and assertively toward our COVID recovery, maintaining a balance in the workplace between safety and security while delivering these critical services to the public. So these adjustments recommended to you today will keep us on track with that goal to leverage our revenues for community service and to safeguard the general fund for sustainable operations. I do want to point out that almost half of the adjustments in this report will support our Health Services Agency and the Emergency Operations Center and the departments in COVID response funded with federal relief revenues. An additional 33% of the total increase is due to state pass-through funding for CalWorks grants. Staff will highlight these adjustments along with the significant technical adjustments department request to finish up the fiscal year. So I will tell you there's a lot going on in third quarter, which is why we wanted to go ahead and present today. I have asked our team to be rather brief, but we are open for questions on any one of these topics and are prepared to answer them. So thank you.
Okay, thank you. With that, you did note Patrice Dietrich, Assistant Executive Officer, and this is Jill War, Deputy Executive Officer. Our whole team has worked with the departments to pull the third quarter financial report together, and we are dispersing on multiple projects, so you'll see the two of us this morning. The final budget was approved on September 22nd, 2020 at $1.5 billion. Since that time, the county budget has been adjusted to include carryover appropriations from the prior fiscal year, along with adjustments approved as part of separate board agenda items. Combined, the sum of those adjustments through March totals $131.6 million and is included in this chart shown, reflecting the county's operating budget at $1.7 billion as of March 31st, 2021. This table shows the adopted county budget and the at final budget, and then the operating budget as of March 31st. Recommended adjustments with third quarter total to an increase of $19 million, and bringing the total county budget for third quarter to that $1.7 billion that I mentioned. This chart shows the recommended third quarter budget organized by board priority area, and the largest component on the right side of the donut chart there is represented by departments within the priority of supporting community health. That is at a total of $748.6 million, or 44.6% of the overall county budget. And as you know, this is the priority area in which the majority of programs and services are mandated and funded largely with federal and state revenues, really targeted at our safety net programs. This chart provides a 5-year comparison of discretionary revenue activity as of third quarter. For each year, the light pink bar shows the third quarter actuals, the taupe bar in the middle shows final budget, and the burgundy bar depicts year-end actuals. In the case of the current year, 2020-2021, the burgundy bar is showing our third quarter projection, inclusive of the recommended adjustment that we have today. This adjustment is based on staff analysis of discretionary revenue, including the year-to-date receipts, historical trend analysis, and then really considering information from our outside consultants, the HDL firm. What is changing here is in the category of sales and use taxes, and the growth trend that we identified at mid-year has continued through March. Reports for sales and use taxes have been produced by the county's financial consultants, and they are able to consider impacts from COVID-19 emergency orders, legislation on consumer purchases, and the actual tax payments to the state. So there are several competing factors that don't align with what our historical trends might project, including the state policies on deferrals, et cetera. With all of that, we are recommending a $2.4 million increase in sales tax due to the stronger economic forecast locally and the higher receipts that are projected. If we were excluding the recent kind of volatility due to COVID, our historical trend analysis might identify as much as 33 million in total receipts, whereas we're projecting at 30.9 million. So we're going to continue to monitor sales tax every month. I was just looking at the monthly reports this morning. The beginning of the year was rocky in comparison to the prior year. We had a couple of months that were lower receipts, a couple of months that were essentially neutral, but our two most recent receipts, which are recognizing through the holidays, are up significantly over the prior year. So we'll hope that that trend continues, and we'll be able to give you hopefully positive information again about our economic trends when we come back at proposed budget. Okay, as noted previously, the third quarter financial report includes recommended budget adjustments totaling $19 million. They are displayed on the screen before you in priority area. About $6 million in supporting strong and safe neighborhood departments, $9.4 million in departments supporting community health. No requested or recommended changes in the area of healthy economy at this time. About $110,000 recommended for the one department promoting first-rate learning, our fabulous library, and then $3.1 million in departments delivering efficient public services, just under $70,000 in delivering community infrastructure departments. The following are some of the significant adjustments that are included in the third quarter financial report. We did have several departments report COVID-related revenue losses and require adjustments in order to finish the year in a positive fiscal position. Of note, our Parks and Recreation Department experienced reduced revenues just under $1 million due to closures and camping restrictions related to COVID-19. The department was able to reduce some costs and appropriations by about $400,000 and do require an increase in net county cost of $593,387 to cover the shortfall and close the year in a good position. Within county operations, we have a budget unit that's entitled County Court Funding. It is related to the partnership that we have in support of the courts post the split when the courts return to the state. With that, there is a revenue stream that helps to offset that maintenance of effort cost, and it's tied to civil citations and bail bond forfeitures. Both of those revenue streams were impacted by COVID-19 due to reduced court operations and collection delays, and we are having to increase net county cost in this budget by about $500,000. And then in the General Services Agency, this department was impacted significantly by COVID-19 impacts in staffing that contributed to leaves of absences and reduced billable hours. So the department will be relying on fund balance for about $290,000. Also within the area of county operations, we have a pass-through department budget. It is a vehicle license fee. This is a realignment revenue stream that has increased, and the funds simply come into the county and must be passed directly to the Community Services Agency by state mandate to support the state share of the CalWORKS aid payments, and it's called the CalWORKS Maintenance of Effort. And then finally, for the Department of Behavioral Health and Recovery Services, the department continues to see an increase in out-of-county hospitalization placements for children who are experiencing acute mental health crisis. This requires about a $1.1 million increase in appropriations, funded by $300,000 in additional revenue and reliance on the use of fund balance of about $765,000. Department is also increasing costs related to, increasing the budget line item related to their telecare psychiatric health facility contract costs and an audit requirement to make a revision in their cost allocation methodology. Those two things combine to an increase of $1.3 million, relying on department fund balance. And then fortunately, the department does have contract savings of about $2 million that will offset those impacts to fund balance. So they'll be about net neutral in their fund balance impact. Focusing on the revenue and financing side of the budget equation, third quarter recommendations include $11.4 million in COVID-19 related funding, of which $3.9 million is CRF, coronavirus relief funds, which will come from the Department Operations Reserve previously approved by your board. So the Health Services Agency is appropriating $7.5 million in epidemiology and laboratory capacity funding, also known as ELC. And this will support COVID testing, case investigation, contact tracing, surveillance, containment, mitigation, and vaccine efforts. For the couple of months prior to March 1, the department, at that point, the department established the new required accounting structure for the ELC funding. So there's a couple of months where they will rely on about $1.5 million in CRF funding. Additional $2.2 million in CRF will be dedicated to the Sheriff's Office to cover costs associated with operation of the EOC, Emergency Operations Center. Additional $190,000 will be dedicated to various departments covering costs with the COVID pandemic, including staffing-related costs and legal services associated with COVID-19 issues. So if approved as recommended, the $3.9 million dedication of CRF will still leave $9 million in the County Department Reserve, which staff will be bringing back to your board in the future aligned with the ARPA, American Rescue Plan Act funds. I hope I got that ARPA right. I've been calling it ARPA so much, I'm getting my acronyms mixed up. And so that is the last of my slides, and now I'm going to pass it to Joel to give you the remainder of the financial summary.
Thank you. The third quarter financial report includes many adjustments that we consider to be technical in nature and represent changes needed to ensure a positive fiscal position at year end. So some of those technical adjustments include transfers between cost categories that allow departments to align appropriations with their operational needs and include the transfer of some costs into and out of fixed assets. General fund departments do not begin the fiscal year with funding to cover termination cash outs that may occur. Third quarter provides the opportunity to allocate net county costs to cover these costs once they are known. Additionally, departments continue to update estimated revenue based on new information. And larger departments also right-size the distribution of their administrative and overhead costs using their own departmental cost allocation plans. General fund departments received a vacancy rate deduction at the beginning of the two-year budget cycle through the 2020-2021 zero-based budget process. This deduction is based on historical trend analysis that shows the county experiences a vacancy rate of 9.2% on average. Applying the vacancy rate deduction at the beginning of the two-year budget cycle is a conservative approach to budgeting that prevents over-appropriation early in the cycle. However, funding to cover departmental needs should departments experience minimal vacancies throughout the fiscal year is reserved in appropriations for contingencies for allocation at third quarter when vacancy analysis is performed by the Chief Executive Office, Human Relations Division. On screen, you can see third quarter analysis of actual vacancies has resulted in rebates to 7 general fund departments. Departments experiencing a vacancy rate over 5% and up to 7.5% are recommended to receive a 50% rebate of their applied vacancy rate deduction, with departments experiencing a 5% or lower vacancy rate recommended to receive a full rebate. These technical adjustments total $3.6 million and are funded through transfers from appropriations for contingencies. Implemented as a component of the two-year budget model, the Performance Visioning Carryover Savings, or PVCS program, allows for savings from year 1 to transfer into year 2 for all general fund departments, providing for financial flexibility to support operations aligned with performance visioning within the two-year budget cycle. The transfer of savings is dependent upon a positive economic forecast at mid-year of year 1, which was presented to the Board of Supervisors with the 2020-2021 mid-year financial report and was based on the evaluation of several key financial indicators. The transfer of savings relies on the establishment of a fund balance assignment in the general fund at the end of year one, which is based on estimates provided by departments at third quarter. General fund departments estimate $7.5 million in total in carryover savings. To ensure sufficient funding for these departments in year two, approximately $8 million will be reserved in an assignment at year end. Actual carryover amounts are determined upon year-end close and will be clearly stated and allocated in the 2021-2022 proposed budget. Countywide and departmental challenges and opportunities are noted in the third quarter financial report, beginning on page 13. The impact of federal and state financial policies and social spending patterns changes brought about by the government and personal responses to the COVID-19 pandemic, these have made historical fiscal trends less reliable and predictable than in the past. Fortunately, the county is well positioned to weather these impacts due to a healthy general fund reserve, which has helped support smoothing policies and poised departments to continue to deliver services with the confidence that these can be sustainably delivered. The Community Services Agency, or CSA, continues to evaluate space needs post-COVID in the delivery of key services to the community and is specifically focused on 3 facilities in 2021. CSA has worked with affected partners and is recommending the termination of the leases at West Modesto Paradise Medical Clinic and the Turlock EPIC facility. Recommendations are expected for the Houston Community Services Office lease. All customers will continue to have ready access to services online, by phone, and at the remaining CSA sites. The Internal Audit Division of the Auditor Controller's Office performs critical activities to ensure fiscal transparency, accuracy, and reliability. 2 mandated services the division performs include the quarterly review of Treasury cash counts and purchasing card audits performed annually. The department is consistently challenged to recruit and retain staff for the 4 positions of this division, with all currently vacant positions as we stand now, and is moving forward with a 2-year pilot program wherein these services will be contracted through an independent audit firm. Since the 2020-2021 adopted mid-year financial report, which included 4,563 positions, approved position allocation changes through separate board agenda items have resulted in a net decrease of 36 positions, bringing the total allocation count to 4,527 full-time allocated positions. There are no adjustments recommended in the third quarter financial report that affect the staffing allocation, leaving authorized positions at 4,527. Recommended technical adjustments that do not affect the staffing allocation count include the reclassification of 5 positions, with 2 reclassifications occurring in Aging and Veteran Services and 1 each in the following departments: Clerk Recorder, Health Services Agency, and the Sheriff's Office. Details on these adjustments can be found in the third quarter financial report in the respective department sections, as well as attachment 2 of the agenda item. As a reminder, the county's 2021 third quarter financial report can be accessed on the Stanislaus County website at www.stancounty.com/budget. There are 8 staff recommendations before you today. 1, accept the Chief Executive Officer's third quarter financial report for fiscal year 2020-2021. 2, authorize the Chief Executive Officer and Auditor Controller to make the necessary adjustments as recommended in the report. 3, authorize the use of $4,698,688 in appropriations for contingencies as recommended in the report by 4/5 vote of the board. 4, authorize the Auditor Controller to make necessary fiscal year-end accounting entries to accurately report expenses and revenue in the appropriate fiscal year and adjust appropriations as necessary as approved by the Chief Executive Officer. 5, amend the salary and position allocation resolution to reflect the recommendations included in the report as outlined in the staffing impact section and detailed in attachment 2 to become effective the start of the first full pay period beginning on or after May 22nd, 2021. 6, authorize the Chief Executive Officer to implement the Performance Visioning Carryover Savings Program for fiscal period 2020, 2021, 2021, 2022, and carry forward current fiscal year-end savings into the next fiscal year for general fund departments based on the positive economic forecast presented in the 2020-2021 mid-year financial report. 7, approve contracts and agreements listed in Attachment 3 in cumulative amounts of $200,000 or greater, and authorize the General Services Agency Director, Purchasing Agent, or previously authorized department head to sign. And finally, set a public hearing for the consideration and adoption of the budget year 2021-2022 proposed budget for the 6:30 p.m. meeting on June 15, 2021. Direct the clerk of the board to advertise the public hearing and authorize the clerk of the board to make appropriate changes to the public notice if fee increases are proposed as part of the budget process. So that concludes our presentation for third quarter. Staff are available for any questions the board may have.
Before we go to questions, I just want everyone to recognize in order to move money out of contingencies, it does require a 4/5 vote. And we're asking for I can't even remember the number,
6, 4.7.
Yeah. There you go. Okay, any questions, comments for staff?
Just a quick two things. One regarding the contingencies. I mean, it sounds like a giant number there, 4.7, but it's great in the report that you guys have shown that we originally set up in the budget $12 million, and so we're still by the time we're done, half of that is still left.
We have $6.1 million left after these recommendations are approved.
And that's what's so great about the work you guys do and everybody does here is that we set up these contingencies, we put money aside for all these different things, and it's just I'm just always impressed and continue to be impressed by what you guys do and the work you do. So Patrice and Jill, thank you very much, and Jody and everybody involved in the process. I want to talk about the accountants really quick. Sorry, Jody, you want to go ahead? No, go ahead. I want to save the account for the big finish. Go ahead.
Okay, so I do just want to, first of all, thank you for your comments, but I do want to make it clear for the board and members of the public who may be watching that many of the adjustments that you see in this budget are actually planned in advance. It's just that we have a budget policy and strategy that does not fund certain things in departments at the front end of the year and funds them at the back end of the year, and we stick those funds in contingencies. So these transfers are planned. It's just that we wait to do them later in the year when we know more specifically what the needs of those departments will be based on their performance through the year. So that's why some of these numbers have looked bigger. It's a reflection of the adjustment in our budget policies over the last several years. Thank you.
Perfect. Okay, and then just really quick on the challenges and opportunities with regard to the internal audit activities. And I think it's a great idea to contract out those activities to get those audits done with outside firms. I think that's a great idea. There just isn't the capacity. There's such a shortage of accountants and CPAs right now. And I would even encourage, as we go forward, our payroll department, what we do in-house, I would think we really need to investigate and look at outsourcing that to payroll. There's payroll services that do that. We recommend that constantly with our clients. It's just the liability involved with it, everything that's involved. And like I said, it's good it's so hard to get good people to do payroll, and I know within our own departments we have a hard time retaining people, and they do great work. I have no way I'm criticizing the work. They're just overwhelmed there, and I would encourage us to really consider and look into outsourcing the payroll at some point. That's it. Thank you guys very much.
So I think my takeaway, I always like to wrap up with takeaways, and just in this era of uncertainty, things are looking pretty good, excluding even the CARES Act or the American Rescue Plan. I think that we've seen pretty robust growth recently in sales tax, and we're seeing that everywhere. I've heard that from the cities also. So that's a good economic sign for us, and I try and remind people as things get better here, it's not to thank us because of this revenue. It's the taxpayers' money, and that's what we do, is we provide services as best as we can. So again, good information makes for good decisions. You guys give us great information, so I appreciate it. And with that, I'm going to open it up if there's any comments. Seeing none? You're just waving at me? That was nice. That was sweet. Okay, seeing none, I'm going to bring it back to the board for actions or comments. All right, make a motion.
I will make a motion to approve all staff recommendations.
I will second it.
We have a motion and a second. All those in favor say aye.
Aye.
Opposed? Motion once again carries unanimously. Thank you very much.
Thank you so much. Thank you.
And I'm going to point out really quick before I move on that we have a co-pilot over here, the clerk of the board, Marcy Dunn, sitting in today, first time. Welcome. All right. Going to move on to correspondence.
This board has received a notice from the California Public Utilities Commission that they will begin the process to introduce a new area code to the area now served by the 209 area code.
Refer to the Chief Executive Office.
This board has received a letter from International Rescue Committee requesting that the county revisit the decision to not renew the funding for the Afghan Path Towards Wellness program.
Refer to the Department of Behavioral Health and Recovery Services.
This board has received the claims as noted on the agenda.
Acknowledge receipt of claims and refer to the Chief Executive Office. Are there any Board of Supervisor reports?
I've just had a couple meetings with Angela Freitas, David Lehman, and their respective departments over constituent issues. They have been great to work with. We're able to resolve those issues in a quick amount of time. So I just wanted to give them props, so to speak, and say thank you for all the time that they put in with me.
Shout out. That's great to hear. Okay. Legislative Fiscal Management Report.
Yeah, so we have a few things happening at the state level, a little at the federal level as well. I want to acknowledge that the state this week has essentially announced a $75.6 billion surplus in their budget for this upcoming year. And in addition to that, with the $26.6 million in federal relief funds that the state is in line for, that provides over $100 billion in discretionary spending for the 2021-2022 state budget. And the governor is definitely out in front of this week. We've been reading headlines, and as we were in this meeting, more headlines were being created through announcements about what his intent is for recommending appropriations in a variety of program areas to support this state surplus. I think announcements have already been made this week regarding child care services, an extension of the Golden State stimulus program that looks to provide direct funding back to California residents, as well as the governor mentioned a change in the emergency rental assistance program that would cover outstanding rent utility payments for low-income tenants up to 100% instead of 80%. I want to acknowledge that our county's program was designed on 100%, so it appears that the state has actually moved more towards the county's direction in that program, so that was good news. Also, the governor had declared a drought for 41 of the counties across the state, including Stanislaus County. He visited Merced County yesterday and discussed relief efforts as part of a drought and water resilience package coming forward, multi-billion-dollar package there. He has not referenced any conservation measures or mandates, but we're certainly watching that closely. And I do want to acknowledge that we are looking closely at a local state of emergency potential for drought here in Stanislaus County, but we're going to go ahead and include our Stanislaus County Water Advisory Committee in our evaluation of that issue, and we'll come back to the Board of Supervisors to discuss that sometime soon. We will have additional announcements from the state of California and the governor on items of homelessness. I think I had read something this morning that there's a substantial additional package of homeless funding and strategies coming forward this morning. So we'll be interested to see that, as well as additional announcements on economic development strategies and anything else that is unveiled this week when they release the revised budget proposal on Friday. So this is a big week in state government strategy that we are following. And then in addition to that, I want to mention that this week we also received confirmed guidelines from the U.S. Treasury on how Stanislaus County and other local jurisdictions can access funding through the American Rescue Plan Act. Essentially, no big changes to what we expected from what we call affectionately ARPA. However, we now have the technical path in order to pull down those funds. So you can expect our staff and our departments involved, including the Auditor Controller's Office, supported by County Council, to take whatever steps are necessary to pull those funds into the county treasury as soon as possible. We are working on strategies to bring to this board related to ARPA funding, and you can expect that we will preview those strategies at an upcoming board meeting as early as next week. And that concludes my presentation on legislative update.
Thank you very much, and I would hope we would advocate for some of that money going towards infrastructure being broadband, bridges, transit, all the other things that are necessary. I know that they're talking about it at the federal level, but with such a surplus, we could put that money to work right away in sidewalks and curbs and gutters, everything that we're talking about as a potential leverage. So with that, if there's no other comments, we do have a closed session. CEO, County Council.
Yes, we do have a closed session this afternoon, or this morning still, I guess. We have two items. Conference with Chief Executive Officer, threat to public services pursuant to Government Code Section 54957, Subdivision A. The board will confer with the Chief Executive Officer and County Council regarding matters posing a threat to essential public services and the public's right of access to public services or facilities. The second item is a conference with legal counsel, anticipated litigation pursuant to Government Code Section 54956.9, Subdivision D4. There's one matter there, and we do not expect a report out.
Is there any public comment on closed session? Seeing none, this meeting is adjourned to closed session.